Good afternoon, everyone. Good afternoon. Happy Sunday. How was our Sunday? I hope we were all able to go to church. And if you didn't, there's no problem. Don't just miss it next week. So, I am happy to be in our midst today after some time. For a while now, I've not been coming online due to personal reasons. But I'm glad I'm back online and we are good to go. So good afternoon, and welcome to today's episode of House of Becker Health Talks, brought to you proudly by Becker Health Foundation. And I remain your host and presenter, Nurse Anane Rebecca. And I've been the host for some time now, giving you health tips back to back, including both health tips that are necessary for nursing mothers, that are necessary for pregnant mothers, and also the general public. So today we'll be having a brief talk, even though I promised this was going to be interactive, but I guess a lot of our viewers are not online. They are not online yet. But while we wait for them, let's just continue. So topic for us all, a very sensational topic, which is titled Peptic ulcer. A lot of us have been hearing about ulcer, talking about it, but how many of us really know how it comes? I don't know if I've treated this topic before, but it's gonna be, if I've treated it before, it's fine. It's just going to be a reminder and a bonus to you all. For those that have not subscribed to our YouTube channel, so you can get a benefit of hearing it and knowing what it's all about once again. So once again, I welcome you to today's episode of House of Becker Health Talk, brought to you proudly by Becker Health Foundation. So quickly to what we have today, I'm not going to take much of our time because I wouldn't want to burn our data. So today we'll be talking about peptic ulcer. So what is peptic ulcer? A lot of us are I'm an ulcer patient. Some patients will come to you and they will tell you they already know they are an ulcer patient. How did they get to know? Okay, aside from finding out from a health professional or from your health professional, is there any way you can actually know whether is there any way where you can actually know whether you're an ulcer patient or not? So that will be all we'll be talking about today. So I'll be giving you tips how you can find out if you're an ulcer patient or not, and what are the benefits and what are the things you can do to help yourself, the home remedies. Because fine, the person might be on a long-term drugs for a while. Ulcer is similar to hypertension, where the patient will have to be on drugs for like a month or more just to reduce the acid production. But then there are other home therapies that the patients can do to actually help and improve him or her lifestyles and healthy living. So quickly, what is peptic ulcer? So peptic ulcer is an excavation or an erosion of the stomach lining. That is, there's a membrane that is covering the stomach that helps to cushion it and protect it from the acids that are being produced by the body from eroding it. Now, the stomach produces some acid to help digest food, such as the pepsin and the trypsin and other enzymes that helps to digest food. Now, when this acid contents, like the hydrochloric acid that are being produced in the stomach to help digest food, when they are being produced for a long period of time, they definitely erode that stomach lining. And why do that occur? That occurs when the stomach lining is no longer, let me put it this way, is no longer strong enough to cushion that stomach. And why do that happen? The linings become weak when the person overtakes all these analgesics, non-steroidal anti-inflammatory analgesics, such as ibuprofen, naxolin, all those strong analgesics that wears away or make the membrane of the stomach to become too weak enough to cushion it. So now when the stomach's lining are weak, the acid normally is being produced on a daily basis by the stomach. And when it's being produced, it eats up everything on its way, including the stomach lining. Now when the stomach lining are not strong enough, they've been rendered weak. The stomach acid is able to eat them up, and when they eat them up, it causes sore on the stomach. The sore you see on your body when you injure yourself and you see blood coming out, that is the kind of thing that happens to the stomach. So there's sores on the stomach. So when those sores occur, it is called an ulcer. Sometimes we call sores on the leg ulcer. So when the sores occurs in the stomach, it is called the peptic ulcer or the stomach ulcer. But sometimes it is called peptic because it's not only the stomach that is affected sometimes. Sometimes it gets to the upper part of the stomach, which is the duodenum. The first part of the stomach is the duodenum before the jejunum. So now when the duodenum is affected, or the upper part relating to the chest is affected, it is related to as peptic ulcer. Grouped together, they are called peptic ulcer. But under peptic ulcer, we have the duodenal ulcer, we have the stomach ulcer, which is also the gastric ulcer, and the jejunum ulcer, which is a very rare ulcer. Now, the most common ulcer is the stomach ulcer or the duodenal ulcer. So those are the two we're going to be dwelling on. So now that we've been able to define what peptic ulcer is and the other kind of ulcers that are beneath it, let us quickly go to what the causes are. Like I said earlier, it is caused by overuse or abuse of use of non-steroidal anti-inflammatory drugs such as your ibuprofen, for example. Now there are some people that take all these non-steroidal anti-inflammatory analgesics. They overuse it. Any pain they feel, they've taken it. Any pill, even when you're supposed to just take some water to just help yourself, you just rush and go and take those analgesics, and then they help to wash away the stomach lining. Thank you for that question. So an example of the analgesics is ibuprofen, like I mentioned. Your ibuprofen, your diclofenacs. People that like taking Lofnax, they are all under diclofenac group. Some people call it Nofnac, some people call it Clofnac, some people, it's different branding, it's just branding. Everything is still diclofenac. So your diclofenacs, your ibuprofens, they are dangerous to the body because they help to wash away the stomach lining. They help to eat up the low stomach lining. That is how they affect their release of pain relief to the patient. So what is advisable for anyone in pain, what is advisable is taking of acetaminophen or what we call paracetamol. Like a lot of people will have cramps and then they will rush to Buscopan, they will combine Buscopan, Felvin, ibuprofen, diclofenac. They will say because the menstrual cramp is too much. You're harming yourself, you're endangering yourself, and you're exposing yourself to being at a risk of having a peptic ulcer. And sometimes it's not only this non-steroidal anti-inflammatory analgesics that causes them. Sometimes when you have excess production of Helicobacter pylori, it's a kind of bacterium that stays in the stomach and that lives there. That's the general habitat, because we have some bacteria that live in the body as their general habitat, as their normal habitat. Now, when this bacteria overproduces itself, it eats up the stomach lining too and exposing themselves to making the stomach exposed to ulcer. Okay, like I said, the NSAIDs, I said ibuprofen and diclofenac. I hope we get that. So it exposes you to ulcer. So those are the two main causes. Now, there are other risk factors. I won't call them causes. And why do I call them risk factors? Because if they occur naturally, you won't be at risk of, you won't have ulcer. But they are risk factors in the sense that over time, it has been proven that over time, when they continue to occur for a long period of time, you are at a risk of coming down with ulcer. And what are those things? Stress, emotional imbalance. Those things are also risk factors of exposing someone to peptic ulcer. How does stress cause it? When you're stressed out as a person and you don't rest, your body will want to work, your body will want to continue working, and you are tired. So your body produces what we call adrenaline. Now, excess of adrenaline in the body is not good when it is not needed. Why? What is an adrenaline? An adrenaline is like a flight and fight response of the body to any proposing danger or increase of energy. Now, these hormones, when they are produced in excess for a longer period of time, they tend to act on all parts of the body because adrenaline works on every part of the body, including urinary tract. Everything is worked on. Now, when these hormones are produced for a long period of time, they affect the body and especially the stomach. They wash away the lining of the stomach, and over time, you'll find out that you're having the symptoms of ulcer. And to emotional imbalance in the sense that you're having anxiety, worries, depression, all those things. They releases some hormones in the body to call serotonins. Those serotonins too are not healthy for the body. There are some specific times that such hormones are supposed to be released, and when they are released at a wrong time and they are produced over time, they act on the body and also erode the stomach lining. So it has been proven that these two, your emotions and your stress, are risk factors. I didn't call them causes, please. Let's not mix it up. They are risk factors to peptic ulcer. While I said the main cause is the overproduction of the Helicobacter pylori, and another cause is overuse or abuse of non-steroidal anti-inflammatory analgesics. So rushing to symptoms, I said earlier, I won't want to take much of our time. Rushing to symptoms. So what are the symptoms? The symptoms that are common is you notice nausea, the person will feel like vomiting, there is stomach pain. Each time the person doesn't eat on time, the person starts to feel stomach pain. And when the person eats, the stomach pain subsides. The stomach pain reduces. There is pain on the upper part of the stomach, the ribs, the sides, and also vomiting. And in complicated cases, you notice the person coughing up blood. There is vomiting, and when the vomiting occurs, it's a blood stained vomitus, or the passing of dark stool. That is, the blood has mixed with the stool of the person. That is, there is already perforation and the stomach wall is already bleeding into the intestines. So when the person passes out feces, there is dark in color. Why? Because there's blood mixed with it. So those are the extreme cases when the ulcer has already excavated or gotten to the level of admission. Now, some other normal signs that you see, as you just notice that on empty stomach you feel pain, and you always have this nausea feeling, and each time you eat you feel the pain reducing or subsiding. So rushing to the home remedy, that the main reason why we did this online talk is the home remedy. Now, as a nurse, I've noticed that a lot of my patients get comfortable with fruit therapy than drug therapy. Most of them do come back to say, nurse, I'm happy you could help me with this fruit therapy. That's helped me a lot. So I'm going to be talking more about fruit therapy, or as a home remedy for ulcer. Now, as a person, like I told you, ulcer is caused by the excess production of the acid, which wears out the stomach lining. Now, how do you reduce this acid in your stomach when you notice you have still symptoms of ulcer, like I mentioned earlier? How do you reduce them? Take fruits that are low in acid. Like I do tell my patients, if you can't come to my therapy section and then I won't place you on fruit therapy, that's me for you. You are always going on with a fruit therapy, even as you're going on the medication therapy. Now, my fruit therapy is this. When you wake up in the morning, take a fruit before you leave the house. Take fruit as your breakfast. While you're eating your lunch, before you eat the lunch, 1 hour before eating the lunch, take fruit. 1 hour before taking dinner, take fruit. You see a lot of changes in your body system, a lot of changes in the way you look. Like, it's a transformation. We don't know what fruits are. We don't know the importance of it. That's why we all fall sick most of the time. So when I talk about low fruits fruits that are low in acidic content, we have bananas. Banana is very, very good. Like, if you want to try it, just take 2 banana stands every morning on an empty stomach. You will see the kind of wonders those bananas will do on you. Take bananas, watermelons, they are very good. You can make it in form of a juice, that is, blend it and drink, which is very, very helpful. But make sure you're blending with the white hard parts of the body. Don't just blend the colored part of the watermelon. Blend with the white hard part. If you can blend the green part, you can also blend and drink. It is very medicinal and very good. Medicinal in the sense that it helps to boost the immunity against malaria. That is a tip that I just gave today. So you can take watermelon juice. You can take watermelon on its own. Pawpaw is a very rich fruit. It contains a lot of sodium and potassium, and those two help to coat the membrane of the stomach. They are very important in the coating of the membranes of the stomach. So they are very, very good. Pawpaw is a very good example for an ulcer patient. Sorry about that, for an ulcer patient. So please and please, these fruits, berries too are very good, but berries are hard to come by. So I don't really give berries as a fruit option to my patients. I give them fruits that are readily available. So they won't tell me, please, I was not able to get this fruit. So I don't give berries. But if you know you are in an area where you can get berries and dates, dates are very good. They are medicinal. They are also good for typhoid treatment. They're also good for any patient that has been on typhoid treatment for a while. After the treatment starts on dates will help to reboost your immunity and replace all the lost nutrients. So dates and berries are very good fruits. But for those that are readily available that you can get easily, dwell on watermelon, pawpaws, and bananas. Those three fruits are very, very good for an ulcer patient. So I hope I've been able to scratch the surface, if not much. But if you need more inquiries, if you need more treatment, and you really want to know more, please don't hesitate to send us a DM. Yes, don't hesitate to send us a DM. And I'm going to drop my mobile clinic number after this live video. So if you want a consultation, you can come to our online mobile clinic where we'll be able to attend to you fully, and all patients are treated as priority. We don't segregate. Everyone is treated as a priority, and we have health teachings every Wednesday online on the group platform where we teach all our patients on how to take care of themselves, on home remedies aside from medication therapies. And we also have our lab technicians at standby if you need tests to be done at any point in time. And please don't forget to always subscribe to our YouTube channel. Yes, because we might not have time to always come on here and post them, but most of our videos, we've talked about them, and they are all on our YouTube channel. And if you're able to subscribe, you'll be able to get full access to it, and you'll be able to be notified each time we post any video. And I hope that we've been able to get something. So I would stop here for today. Please don't forget to join me next week Sunday. And I remain your humble host and presenter, Nurse Anane. Write it in. So I'm going to post the link to our mobile clinic, or the number, to our mobile clinic. It's on WhatsApp. You send us a DM and we'll be glad to reply. Thank you for joining us for today's episode. Thank you for the questions. We appreciate them, and we appreciate every one of us. And those that couldn't join in, God bless you too. We appreciate you. So have a lovely evening and happy Sunday once again. Thank you. Stay blessed.